Are my hormones unbalanced? How do I know?
Hi Taylor, first of all, love you so much. Second of all, thank you for giving me an opportunity to talk about one of my favorite things ever, hormones. My name is Dr. Jessica Reinick. I'm a reproductive endocrinology and infertility specialist, and I live and breathe hormones, talk about them all day, every day. And Taylor, I'm sorry, but the internet is lying to you and many, many other people because there's no such thing as hormonal imbalance, and anyone that's trying to tell you to balance your hormones is probably trying to sell you something. And the reason I say this is because our hormones are going up and down throughout the cycle depending on what hormone it is and what is going on in your body, and I'm going to try to draw it out for you so that it's more easy to understand. There are two main phases in the menstrual cycle, the follicular phase and the luteal phase, and those are separated by ovulation. The first hormone we're going to talk about is follicle-stimulating hormone, and that's the hormone that comes from the brain to tell your ovary to make an egg. And so FSH is highest at the beginning of the cycle, there's another little peak mid-cycle, and then in the luteal phase it's low because you're now growing an egg. It does start to go back up at the end of the luteal phase when your body's getting ready to make another egg for your next cycle. Now, as your body's growing an egg, it is making estrogen. So that's the next hormone that we're going to talk about. And since estrogen's made by the egg, it's low at the beginning of the cycle when you don't have an egg growing, and then as your follicular phase progresses, it becomes higher and higher. It does dip around ovulation a little bit and then peaks back up again during luteal phase and then drops again. Now, once estrogen reaches a certain level for a certain length of time, that then leads for your body to release LH, or luteinizing hormone, and that comes from the brain, and it leads to ovulation. So it's low pretty much all of the cycle. After that estrogen reaches that level that it needs to be at to trigger your surge that indicates you have a mature egg, it spikes up for about a day, and then it drops back down, and in the luteal phase, it's low again. After ovulation is when you have the corpus luteum that comes from that follicle that housed the egg in the follicular phase, and that's making progesterone. And progesterone is progestational or pro-pregnancy. And so it's high in the luteal phase. If you get pregnant, it continues, and if not, it drops down, and then someone would get their period. And the whole thing starts all over again. Do any of those hormones look balanced to you? No, that's because they're going up and down depending on what is happening in your cycle, and they are supposed to be doing that. Now, there are definitely disease states that prevent that normal pattern of your hormones to happen. However, you really just need to treat the underlying issue, not worry about balancing your hormones. And certainly someone that is having all of these things happen shouldn't be trying to balance their hormones either. So Taylor, no need to worry about balancing your hormones or figuring out if your hormones are balanced. The best indicator of that is if you are getting a regular menstrual cycle. If you're not, and you're not on some kind of hormone to prevent that, then you should probably get checked out, but you don't need to worry about balancing your hormones because that's really not a thing.